Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Let's talk about community care and the eligibility requirements to receive it, to go get care out in the community, away from the VA, from a public doctor, private doctor, whatever. So with that, please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. All right, so on the VA's website here is eligibility for community care outside the VA. So let's see what they say. As a veteran, you may be eligible to get care outside VA. This means we'll pay for the cost of your care from a healthcare provider in our community care network. Keep reading on this page to find out if you're eligible for community care. So, already it's sounding like you don't automatically get community care. You have to find out if you're eligible for it. Now, there's a notation though, and it says, you can still always choose to get care at a VA health facility. So choosing community care does not disrupt your ability to get VA care. All right. Eligibility requirements. To be eligible for community care, you must meet the requirements listed here. You must meet both of these requirements. So there's 2 bullet points. You're enrolled in or eligible for VA health care. So in other words, you have to be in the system. You have to be part of the VA healthcare system. The next one is you have approval from your VA healthcare team before you get care from a community provider, except for certain cases like urgent or emergency care. So if you get in an auto wreck and you get taken to emergency room at a hospital, that's fine. But your standard care, you have to get approval for that care before you go. You can't just decide, I'm going to go out to the public and then just send the bill to the VA. It doesn't work like that. So you have to get approval first. Then there are, let's see, it looks like 6 bullet points. There's 6 bullet points here, and it says you must meet at least one of these requirements. So one of 6. You need a service that we don't provide at a VA health facility. So you need a service that we don't provide at a VA health facility. That's the first bullet. And remember, it's any of these. The next one, you live in a state or territory that doesn't have a full service VA health facility. Next one, you don't qualify, let's start that again. The third bullet point here, you qualified under the 40-mile distance requirement on June 6th, 2018, and live in a location that won't still make you eligible under these requirements. All right, so you qualified under the 40-mile distance requirement. So they're talking about the distance from you to the provider, the VA provider, right? So if it's 60 miles, right, to get to your VA hospital for whatever care, and you met that requirement on June 6th, so you still lived in that same place or whatever, June 6th, 2018, and you started seeking care somewhere else, and you live in a location that would still make you eligible under these requirements. Okay, so so in other words, they're grandfathering in the 40-mile distance rule for you as long as you had it prior to June 6th. All right, that was kind of hard to unravel. All right, next one. We can't, and we as the VA, can't provide the care you need within our standards for drive and wait times. Now, I thought at some point that it was 30 days wait time, and I thought it was a 30-mile thing, a 30-mile. I know they had changed it a couple times, but I think they may have dropped it down to 30, and that's why they have that 40-mile grandfathered in one. So I think that they may have dropped it down to a 30-mile. We'll see if they shine any light on it. But so their standards for drive and wait times. So if they cannot provide you the care you need within their standards for drive and wait time, they'll allow you community care. There's 2 more bullet points here. One is you and your VA provider agree that getting care from an in-network community provider is in your best medical interest. Okay, so I just did a video on specifically some folks in Florida, but this could be nationwide, who are being declined community care. They were getting community care for however long, and they were getting mental health care. And then the VA has bolstered up their numbers and locations. And so now they don't meet, I'm assuming, the drive and wait time standards. So the VA is denying community care. However, if you go to the VA, have a conversation with the VA, and really explain to your VA provider and get them to agree that getting care from an in-network community provider is in your best medical interest, you might be able to get back out there to your community provider. So and get that community care. So just food for thought there. That's the 5th bullet point. Let's jump to the 6th way in which you can obtain community care. It says we, again the VA, can't provide the service you need in a way that meets our quality standards. So it's their standards, not yours. So there could be a difference, right? So I think that 5th bullet point is probably going to be the most utilized, is if you can get your provider to agree that you are better off getting care in the community. That could be a way that you can reintegrate back into the community care program for those that have been cut off. All right, so moving on here, it says examples of when you may be eligible for community care. Here are 6 examples of when you may be eligible for community care based on each requirement. So, example 1, a service we don't provide. You need dialysis, but we don't provide dialysis at any of our facilities. So, you're eligible to get dialysis from an in-network community provider. Example 2, no full-service VA health facility. You live in Alaska, Hawaii, New Hampshire, Guam, America Samoa, the Northern Mariana Islands, or the U.S. Virgin Islands. We don't have a full-service VA health facility in your state or territory, so you're eligible to get care from an in-network community provider. Number 3 example, qualification under the 40-mile distance rule requirement. That was a mouthful. You live in Alaska, Montana, North Dakota, South Dakota, Wyoming, and you previously qualified under the Veterans Choice Program 40-mile distance requirement on June 6, 2018. So you're eligible to get care from an in-network community provider. Example 4, drive and wait time standards. For primary care or mental health, if you need primary care or mental health appointment, but we can't schedule an appointment for you at a VA health facility that's within a 30-minute average drive from your home, or we can't schedule an appointment for you within the next 20 days. There you go. In each of these cases, you're eligible to get primary or mental health care from an in-network community provider. So it's 30-20. It's a 30-minute average drive, not miles, minutes, and a 20-day appointment. For specialty care, you need an appointment for specialty care, such as cardiology care for a heart problem, but we can't schedule an appointment for you at your VA health facility that's within a 60-minute average drive from your home, or we can't schedule your appointment for the next 28 days. In each of these cases, you're eligible for specialty care at an in-network community provider. So your number 5, your best medical interest. If this is that 5th bullet point that I talked about, you have a certain health condition that your VA provider doesn't have experience treating, but you live near an in-network community provider who specializes in this condition. If you and your provider agree that it's in your best medical interest to get care from the community provider, you're eligible for community care for this condition. Quality standards is number 6. You need cardiology care for a heart problem, but we've determined that your local VA healthcare facility doesn't provide cardiology care. That meets our quality standards. You may be able to get cardiology care from an in-network community provider. So, with that, that concludes it. That is how you can obtain community care and the requirements surrounding it. Thank you so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.